for my value debate, I chose the topic that the United States should provide universal basic health care. And for the history of my topic, I said the issue of general medical care has been a subject of discussion in the U.S. for quite a long time. Access to reasonable medical care is fundamental for the prosperity of residents and the general working of society. With rising medical service expenses and variations in access to health care, whether or not the U.S. ought to give general essential medical care has turned into a focal concern. Envision experiencing a daily reality such that everybody has the privilege of medical services on an impartial premise, regardless of their financial circumstances. This objective upholds the idea that all people in the U.S. should approach stability with health care. The United States ought to provide universal basic health care. I affirm the proposition. Universal basic health care is, by definition, healthcare refers to a healthcare system where all citizens have access to essential medical services without financial barriers. My value premise is health. I define health as a state of complete physical, mental, and social wellness, not only the absence of disease or weakness. I view good health as a fundamental human right that society ought to uphold and defend. It encompasses not just the lack of illness, but also the accessibility of the resources and healthcare required to ensure everyone's wellness. My value criteria is equity. Equity is healthcare means ensuring that everyone has the opportunity to attain the full health potential and that no one has a disadvantage from achieving this potential due to social or economic circumstances. In the case brief, I will present 3 affirmative arguments in support of providing universal basic health care in the United States. The first being improving public health outcomes. Universal basic health care significantly improves public health outcomes. Compared to countries without these systems, nations with universal health care enjoy lower fatalities and greater longevity. In long term, increasing preventative care will result in quicker illness recognition and therapy, which will lower total healthcare cost. Accessible healthcare ensures timely vaccinations, reducing the risk of widespread epidemics, and improving community and immunity. Providing universal basic health care upholds the value of health by enhancing the overall wellness of citizens, reducing mortality rates, and ensuring a healthier society. Equity is upheld by ensuring that everyone has equal access to health care services despite their socioeconomic status. Having established the positive impact of universal basic health care on public health, let us proceed to the next argument. Economic stability and productivity. Universal basic health care contributes to economic stability and increased productivity. Healthier people frequently produce more at work, which improves economic activity, improves both personal and family standards of life. Universal health care promotes economic growth by reducing financial strain on families, permitting them to spend greater amounts of goods and services of their choice. By focusing on preventative care, universal health coverage reduces the economic impact of chronic diseases, lowering healthcare costs, and enhancing workforce productivity. Ensuring universal basic health care upholds the value of health by fostering economic stability, supporting individual productivity, and promoting overall societal progress. Equity is maintained by creating a level playing field where everyone has equal access to healthcare, regardless of their economic status. Having discussed the economic benefits, let us move on to the final affirmative argument. Social cohesion and equality. Universal basic health care fosters social cohesion and promotes equality in society. Accessible healthcare reduces disparities in health outcomes among different socioeconomic groups, promoting social equality, and cohesion. Universal health coverage ensures that marginalized communities and vulnerable populations receive necessary medical attention, reducing social disparities and fostering inclusivity. By prioritizing the good health of all citizens, universal basic health care creates a sense of social solidarity, strengthening the fabric of society. Providing universal basic health care upholds the value of health by promoting social equality, fostering inclusivity, and enhancing social cohesion. Equity is preserved by ensuring that marginalized communities and economic disadvantaged individuals have equal access to healthcare services, promoting more even handed society. I affirm the proposition that the United States ought to provide universal basic health care by improving public health outcomes, contributing to economic stability and productivity, fostering social unity and equality. Universal basic health care aligns with the core values of health and the criteria of equity. Upholding health as a fundamental human right accessible to all is essential for building a just, equitable society. Equity is maintained by ensuring equal access to healthcare services for every citizen, regardless of their social and economic background. In the pursuit of a healthier, more prosperous, and inclusive society, let us stand and support universal basic health care for all. Thank you.